Let's hear from Princess Dugba, please, Deputy Minister of Health and Sanitation, Ministry of Health and Sanitation from Sierra Leone. Welcome.
Thank you, Dr. John Wood. Good afternoon, everyone. It's a privilege to be here. I'm from the small country of Sierra Leone, which has 7.5 million from the West Africa part of this world. I'm here today really to talk about hepatitis. Apparently, what I would say really, we've been caught up. We are overwhelmed because hepatitis in Sierra Leone has increased considerably. It's about 1.2 million people that are suffering from hepatitis B. That is 18.8% of the population. We have 8.7% among healthcare workers who are suffering from hepatitis B, 11.3 pregnant women, 15.2 blood donors, 16.7% in school-age children, 21.7% in people living with HIV. And those suffering from hepatitis C, we have 8% in male blood donors, 7% in female blood donors, 4.1% in HIV patients, and 2.0% in school children. The reason why we are really we are on the increase is because it's a country that has been really had its own fair share of diseases. We had Ebola for a long time. We were battling with that. And then we are also caught up with the COVID. So it's like the health system hasn't been really able to look at a disease that is coming up, and that's HIV and hepatitis. So hepatitis is on the increase because in Sierra Leone, we don't have the privilege of screening everybody. The only cohort of people that we screen regularly is pregnant women. And most people really don't go to hospitals because of cultural background. And in Sierra Leone, prior to this time, they had like bloodletting ceremonies, which was done in an unconventional way where there was a transmission of hepatitis, which was not known to the public. But as screening is going on, we are now knowing that hepatitis is on the increase. And what we are trying to do really is to quickly try to screen people so that people know their status. But in so doing, Sierra Leone is a country that has riverine areas where it's very difficult to get people to come for screening. So we are trying to educate the masses to know that we have hepatitis, which is at our doorstep. So people have to come up willingly to be able to be screened for hepatitis. And that is really very difficult because we all have our own traditional beliefs. People don't like going to hospital. So we are trying our best as a country to put in structures to be able to do the screening. Another thing is we don't have really specialized doctors that are specialized in hepatitis or nurses. So the country is quickly putting in structures that will be looking at specialized doctors and nurses to be able to screen and treat people that have hepatitis. And also with hepatitis vaccination, it's only limited to people that have like mothers and the babies that have hepatitis B. You don't have the privilege of being vaccinated. So we are looking into these mechanisms to make sure that people are being vaccinated so that they, especially healthcare workers who are frontline workers. So really in Sierra Leone, it's a privilege to be here amongst you, to join you guys to be able to eliminate hepatitis before 2030. Because it's not something that we are sitting on our laurels. We want it to be done hastily because it's a disease that it takes ages for people to know that they are suffering from it. So if they know their status well before time, they can have treatments. So on behalf of the government of Sierra Leone is willing and happy to join the group of friends for the elimination of hepatitis. Thank you very much for listening.